Let's see. Can you go ahead and read this one?
That's EDODCFO.
Just gonna go ahead and take here a few measurements. Hi, Kevin. How are you?
Yeah, I'm good, thank you.
I'm glad. So I'm Dr. Ivy, and I'm gonna be doing a full body examination on you today. I think you're here just for a routine exam, right?
Yeah, correct.
Are there any symptoms lately that you've noticed? Anything specific you would want to discuss?
I think that my eyesight might be getting worse.
Okay. Do you wear glasses or contacts?
Yeah, I do wear glasses.
Okay. Do you wear them all the time?
No, usually just for driving or when I go to some trip so that I can just, see the sightseeings and so on.
Okay. Do you know what the prescription is on them by any chance?
Honestly, I'm not sure. I think it's somewhere around 0.5,
Okay.
maybe 75, but I don't know.
Okay. We can double check that. Okay. Can you just confirm your date of birth before we start?
Yeah, it's 20th of July,
Okay.
1996.
Okay. Perfect. Okay. So I'm going to start taking your vital signs.
Okay.
Just going to put on my gloves first. Have you had any flu-like symptoms in the past couple of weeks?
No. I just have stuffed nose
Okay.
most of the time, like
Most of the time.
chronic cold, basically.
So that actually might be allergies. Especially around this time of year, they can get a little bit worse.
Yeah.
So we'll take a look at your nose too, just to see if all the tissue is looking healthy or if there's any irritation.
All right.
Okay, I'm going to be putting this on your arm. Okay, so I'm just going to go ahead and adjust this. It's going to feel a little bit tight, so it might be a little bit uncomfortable for a few seconds.
Okay.
But it's not going to last long. Okay. Just going to put on my stethoscope. Place it right here. Okay, I'm going to start blowing a little bit of air. So it's going to start inflating. So that is a little bit low.
Okay.
35/64.
Mm-hmm.
Is that normal for you to have low?
Yeah.
Are you feeling dizziness or anything at the moment?
Not at the moment. Yeah.
So we've got do you ever get lightheaded or kind of like see black or something like that?
I do, especially when working out or when there is like a hot weather
Okay.
and there is not enough fresh air.
Okay. So we might do some additional tests for that, but for now, I'm just going to continue.
Mm-hmm.
Okay, so I am going to ask you just a couple of questions to update your medical history since last time.
Okay.
Can you confirm if you have any allergies?
I'm not sure, to be frank.
Okay. You've never had any allergic reaction to
No,
anything?
I never had it.
Okay, so no known allergies. Are you taking any medication currently?
Not at all. I try to
Vitamins
avoid
or?
that. Not that
really.
either. Yeah.
Okay, that's
I'm not
fine.
very consistent, so I don't really see the point.
Okay. Good. When was the last time that you had an OBGYN examination?
About 4 months ago.
Okay, that's perfect. Any unusual findings?
No.
Perfect. Okay. Any history of chronic illnesses in your family?
Yeah, we do have schizophrenia in my family.
Okay.
Yeah.
Okay. And then how about your habits? Do you drink alcohol?
No.
How's your water intake?
I drink a lot.
Okay, that's great. A lot, how much you would say per day?
Oh, honestly, I don't know exactly like the number,
Okay.
but it's probably 8 to 10 glasses of water a
That's
day.
perfect. Because there is such a thing as drinking too much, so.
Yeah.
But this is perfect.
I usually drink the most right before sleep. I'm like the most thirsty.
Okay, that happens. It's very common. Okay, how about your eating habits?
I do eat about 2 times a day,
Okay.
but it's quite a huge portions.
Okay.
But I mostly eat around the noon, like 12 to 3 o'clock in the afternoon, and then at night, usually around 6 to 7. So it's something like intermittent fasting, but not really on purpose.
Okay.
Yeah.
And you just don't feel hungry in the morning usually?
No. And I'm also the most productive, and when I eat, I just kind of feel like down a little bit, you know, because of the carbohydrates intake. So I just prefer not to eat in the morning, basically. Unless I'm going for exercise later.
Okay.
So I will eat before that.
Okay, that's good.
Because I have the low blood pressure and I just feel dizzy then.
Okay,
Yeah.
makes sense. And if you were to describe your diet, would you say it's pretty balanced?
I would say it's pretty balanced.
Okay.
I try not to eat refined sugars.
That's
so
great.
mostly I do eat like a whole food diet. So basically I cook for myself 2 times a day. Meat, then some vegetables.
Okay.
I don't eat really much fruit.
Okay.
Just strawberries sometimes. I don't really like fruit much.
Okay.
Yeah.
Okay, so that sounds good. And then when was the last time that you got any blood work done?
Not sure, to be honest.
Okay, so we'll probably order some today just to make sure that all your nutrient levels are good and that those episodes where you feel like the pressure is dropping, that it's not due to any nutrition deficiency.
All right.
Okay, so I'll put in the order for the blood work. You will have to fast for at least 12 hours before going to get your blood drawn, okay?
Yeah, that's all right.
Okay, so I'm gonna get started checking your eyes. And for this, first I'm just gonna ask you to kind of like look right ahead. Just gonna move the hair a little bit out of the way. Okay, that's pretty good. Okay, let's go ahead and look straight ahead. Okay. That's good. They're both reactive to light. They're consensual and symmetrical, so that's normal. Okay, we are going to do an eyesight test. I know you mentioned you feel like it's getting a little bit worse, and it might be an issue where your eyesight is like your prescription might have changed, but it also could be due to just dry eyes.
Yeah.
So let's take a look. You're gonna go ahead and hold this in your hand and cover your right eye with your right hand. And I'm just gonna point some rows here for you. Okay. Are you able to read this row right here?
Yeah, it's D, Z, C, O.
Okay, let's see this one over here.
Z, L, B, E, D, D, C.
Okay, now let's try this one.
That's L, D, C, Z, O, T, F.
Okay, and now we're going to be doing this one, but starting on the right.
L, E, D, D,
Okay,
O, E, P.
okay, and finally, let's try this one just regularly from the left to the right.
That's C, F, D, D, E, O, and P.
Okay, that's good. So we're at a 20 out of 25. Oh, sorry, I forgot. Let's do the other eye.
Yeah.
So, yeah, just go ahead and hold that. Let's see. Can you go ahead and read this one?
That's E, D, O, D, C, F, O.
Okay. Now let's go ahead and read this one starting on the right.
Okay, that's T, F, L, Z, C, B, D.
Okay, and this one starting on the left.
C, F, D, T, O, P.
Okay, now let's try this one right here.
Okay, that's E, T, O, Z, C, D, L.
Okay, so your right eye is actually a little bit better than the left. The left would be at a 0.75.
Okay.
And the right one, maybe 0.25, but you could also get away with no prescription at the moment. Maybe next time that you come, bring your glasses with you and I can verify the prescription on them and if we need to adjust it. So, okay. I'm just going to be taking a look. Okay. Again, you can just go ahead and look straight ahead. Okay, there we go. Pull your bottom eyelid a little bit. That's great. Take a look at the other side. Okay, that looks normal. Just looking at the conjunctiva. It's very normal as well. Okay, well, your eyes look healthy. Maybe just a little bit of a change in prescription, but we'll confirm that when you can take a look at your glasses. Okay. Everything else looks healthy. I'm going to take a quick look at your ears as well. So just go ahead and please turn your head this way. Okay, that looks good. Okay, panic membrane looks pearl gray, so that's normal. Okay, the canal is free of any irritation. No abnormal discharge. Looks really good. Okay, I am going to be doing a hearing test. Just make sure that everything's good. I'm just going to move your hair again a little bit out of the way. So you're going to go ahead and close your eyes. I'm going to be using my tuning fork and I'll guide you as we go. Okay, I'm going to be placing this right at the top of your head. Can you hear the sound?
Yeah.
Does it sound symmetrical on both sides?
No, it doesn't.
Or do you hear it louder?
Here.
Okay, I'm going to do that a couple more times. Again, do you hear it louder on your left side or the same?
I think it was sort of the same now. Does it make sense?
Okay, it does. Okay, so we're going to just do this one more time. Does that sound symmetrical?
Not really.
How does it sound?
I think it was a little bit more louder on the right side
On
now.
the right side, okay. Let's go ahead and check each side separately.
Okay.
I'm going to give you two options. Do you hear this?
Yes.
Okay, is that louder or quieter than this?
It was louder before than after.
Okay. Let's do that one more time. So just tell me which one's louder, this or this.
Now the second one.
Okay, it was pretty loud, right?
Yeah.
Okay. option 1. Option 2. Okay, great. Now I'm just gonna place this right here, and let me know when you don't hear the sound anymore.
Yeah. Now.
Okay.
Now.
Okay, great. Okay, so I don't think there's anything wrong with your hearing, to be honest.
Okay.
It is possible just like a little shift in the position of the tuning fork on your forehead might, but it was very, very minimal. Okay. So I'm gonna be taking a look inside your mouth. I'm just gonna have you open for me whenever you're ready.
Yeah.
Go ahead and say Okay. Everything seems quite normal. Now I'm gonna have you you can close your mouth. Just raise your head a tiny bit. Just looking here. You can close them up.
Okay.
Okay. I was just looking at your nose since you did mention you have like a stuffy nose.
Yeah.
And it does seem a little bit inflamed. So honestly, I think it might be allergies, but you might have to go to see an allergist to see if you can find the cause.
It does make sense.
Yeah, it might just be environmental allergies, which are pretty common. And I can still prescribe you some medicine if it's like really, really bothering you. But if not, no. Okay.
I'd rather not take any medicine if it's not completely necessary.
Yeah, makes sense. Okay. Now I'm just going to be taking a look at your skin. So you can just go ahead and close your eyes. Relax. Have you noticed any new moles or any changes in existing moles?
I think I do have more now than I used to have.
Okay.
Yeah.
This little one here. Seems to be a tiny bit different color than the rest of them. So I'm just going to take a sample from the skin around it. It is very small, so I'm not too concerned about it, but I'm still want to be 100% sure. So I'm just gonna have you turn your head this way. those other little tiny spot that's a little bit raised. Let's see how the bit looks. Actually seems okay. Okay. Now I'm going to be just gently palpating your head. Make sure there are no lumps. I'm going to be pressing on a few different points. Just let me know if you feel any pain, okay?
Mm-hmm.
Any pain here?
No, everything's alright.
And just go ahead and turn your head slightly. So just pressing. Checking for any inflamed lymph nodes. Go ahead and swallow for me. Okay, trachea's midline. So I'm going to give you a couple of different scents to smell. If you would please cover your right nostril for me. Sorry. Go ahead and inhale. Are you able to guess what that smells like?
It was just a little bit, but I think it was lavender.
Okay. Now we're going to try the other side. Go ahead and inhale.
I think it might be lemon.
Okay. Okay. Just going to check a few reflexes. So the first one's right on your chin. I'm going to very lightly tap. Okay. I'm going to be checking your reflexes. So just try to loosen up the arm. Okay. Go ahead and just loosen up the arm. Okay. tiny move. That's great. Okay, I'm just gonna grab this one first, like this. Yeah. So just make sure it's loose. Okay. Make sure the hand is loose. Okay. That's pretty good. Okay, so reflexes look good. So now I would like to check your abdomen.
Okay.
And I'm just going to ask you to go ahead and lay down. You're going to be facing up, okay?
Okay.
Okay. Okay, Kevin, so I'm going to start just uncovering your abdomen. And I'm going to be listening.
Yeah.
So I'm just going to lift this a tiny little bit. Just going to place this right here. Okay. I hear all normal bowel sounds, so it's great. Have you had anything to eat today? Or not?
Yeah.
Yeah. Okay. Good.
Quite recently.
Okay. I'm gonna be palpating. First, I'm gonna go pretty soft pressure, and then I'm gonna put on a little bit more pressure. At any point you feel uncomfortable, like, ooh, that hurts, or that
Okay.
feels
Yeah.
like not great, just let me know. Okay, the abdomen seems to be soft, which is good. There's no inflammation, just in general. Now I'm gonna put a little tiny bit more pressure. Oh, that hurts. Just trying to check the limits of your internal organs to make sure we don't have any enlargement. Okay. Any pain here?
No, it's not particularly comfortable, but it's not painful.
Okay. There might just be a little bit of swelling on the digestive tract. Have you ever noticed any bloating or just pain after you eat something?
I don't know, honestly.
Okay. Well, if it's not really bothering you,
I don't usually have issues with bloating, honestly.
okay, that's good. If you ever do, just bring it up at any of your regular appointments.
Yeah.
Okay, I am going to be percussing. So I'm just going to be tapping and listening to the sound of your abdomen. take a look at your scalp really quick, just now since you're already laying down. Okay, so I'm just going to take a quick look here, making sure I don't see any major irritations. Sometimes the health of the hair and the nails can tell us a lot about any illnesses or deficiencies in the body. I don't see any premature graying that sometimes can indicate deficiencies.
Good to hear that.
Yeah, it is quite interesting. Sometimes we see the hair that looks, so it looks dark, and then it has this little portion of white, and then dark again.
Okay.
And it's just like that period where it went white. There was just some deficiency in the body. It can also be caused by stress. But then it went back to growing dark or like the regular color. Okay, just gonna look with this comb and a light just to see if we have any residue coming out of the scalp. So we just gently exfoliate it. Do you ever have any itchiness or excessive dryness on your scalp?
Sometimes a little bit of itching.
Okay, have you noticed that after working out or just like regular throughout the day?
More like after I dye my hair.
Oh, well, yeah, that just could be like the
Yeah.
dye. It's a little bit irritating. And it goes away after a few hours, a few days.
Or usually when I wash the hair, it just kind of goes away, but it's mostly the first night.
Oh, okay. Yeah, that's pretty normal though. Okay, well, everything seems to be okay here. I am gonna check your pedal pulses if that's alright. Okay, so just gonna take a quick look here. Okay, skin looks good. I do notice a little tiny mole kind of on the side of your big toe. Yeah, we just might need to do further testing on this one. It's usually just good practice to do a more thorough checkup on moles that are on the bottom of the feet. Okay. Yeah, this looks good. I'm going to check your Lipinski reflex, so please go ahead and relax. teenager. Okay. And I'm just going to do your pupil pulses right here. Okay, they're both very strong. They're symmetrical, so that's great. And they feel normal rhythm, so that's also great. Okay, so now I'm going to give you a patient gown just so we can take a look at your back, and then we'll be all done, okay?
Yeah.
Okay, so first I'm just do a very gentle look here. There are a few moles. They look pretty symmetrical in shape and very uniform in color as well. Do you usually sunbathe at all?
No, not really.
Okay, that's good. So I'm going to be palpating just kind of like the back, along the spine, just looking for any abnormalities here. Okay. Any changes in temperature? This seems normal. I am going to be tapping very lightly along the spine. If you feel any sharp shooting pain, please let me know. Okay? Great. Now I am going to be using an object. Let me know if it feels cold to you.
Okay. Yes.
Yes, okay. I'm just going to be moving it along the spine and let me know if it feels the same all throughout.
Yeah, I would say it does.
Okay, just one more time here.
Yes.
Okay, and one more time here.
Definitely does.
Perfect. Now, does this feel warm or cold?
Cold.
Still cold?
A little bit more warmer.
Okay, still cold.
Yeah, sort of.
About now?
Mm-hmm.
Okay. Yeah, I'm just going to go ahead and take here a few measurements. Need I have it pretty symmetrical. 7.5 and 15. Great. Okay. So now I'm just going to do a quick test where I use two different objects. One's going to feel dull. Does that feel dull? Does this feel sharp? Not so much. Let's see.
Was this dull?
This was sharp.
Okay.
And this is dull. Do you feel them the same?
Yeah, sort of.
Okay, I'm just gonna grab a different object then. Okay, so this is gonna be a tiny bit different. Okay, does this feel sharp to you? Does this feel dull?
Yes.
Okay, so just go ahead and let me know if you feel sharp or dull, okay?
Sharp. Sharp. Dull. Dull. That was dull.
Okay.
Sharp. 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 Dull.
Okay, now I'm gonna be just tracing the spine with each of the objects. Just let me know if it feels the same all the way through.
Yes, it does.
Okay. Now this one.
As well.
Okay, perfect. Okay, now I'm just gonna be listening to your lungs. Go ahead and take a deep breath for me. Exhale. Okay. One more time. Okay. One more time. Okay. And one last time. Okay. Okay, there's no crackling or wheezing. So we are done with today's full body examination. Honestly, everything looks great. We can just get your prescription checked. And I am going to get some blood work just to make sure all your levels are normal. But there's nothing indicating of any condition at the moment. Just be safe. Okay, I am going to be waiting outside. When you're ready, you can get changed. When you're ready, just come out. If you have any questions, I'll be right there. Okay.
Okay.
Okay, thank you.